Welcome back to Let's Talk Health. As you know, this is a program we talk about different health issues. I'm your host, Dr. Kam'mwamba. And today we are gonna talk about everything we need to know about dentists. As always, I'm joined by an expert. So can you introduce yourself, sir?
All right. My name is Prince Chimenya. I'm a dental technician here at Choro District Hospital. Yeah. In fact, I've been working for more than 10 years. Yeah, I'm a dental specialist.
Uh,
Yeah.
so,
Thank you.
so can you tell us what made you to become a dental specialist?
Um, Nothing specific. Of course, as I was growing up, I never thought of becoming a dentist. Uh, I've actually been uh, uh, lucky to actually pursue uh, a career in other fields other than health field.
Yes.
But what prompted me to actually get into this profession is this other time we were having dinner
Yes.
and we were watching TV Malawi.
Yes.
And there came a certain advertisement from Malawi College of Health Sciences. Yeah. So out of the courses that were being advertised was diploma in dental therapy.
Yes.
So I just said, let me just try to apply. And lucky enough, I was picked. So that's how I actually got into this profession. But otherwise, nothing specific prompted me to actually uh, pursue dental therapy. Yeah, so uh, that's that, yeah.
Yeah. So can you tell us what are the common dental problems you meet with your patients?
Specifically, we have two.
Yes.
Yeah, that is dental caries,
Yeah.
which is also known as tooth decay,
Yes.
and gingivitis, which is inflammation
Yes.
of the gums.
Yeah.
These are the two common conditions that we actually meet day in, day out here.
So when a patient comes to you with these conditions, how do you treat them? How do you treat each of these conditions? Is each of these conditions treated?
As for dental caries, yeah, we have two different types of dental caries. Yeah, we have reversible papitis and irreversible papitis. By reversible papitis, we mean the decay has not gone into the pulp. So what we do is we actually do conserve the tooth by filling the decayed part. Yeah. As for irreversible papitis, we normally do tooth extraction, which is the removal of the tooth. Yeah. I think basically that's what we do. As for gingivitis, we do also tooth cleaning. Tooth cleaning, cause gingivitis comes secondary to like the food stuff that sticks between the gums and the tooth. So this brings in infection. Okay? So our aim when we are like cleaning is to remove that infection so that the gums should go into their place and become healthier again. Yeah.
So can you tell us how can people prevent tooth decay and gum disease?
Okay. Let me just take you back to like history of like these two diseases.
Yes.
For tooth decay or gingivitis to come in,
Yes.
first there should be a tooth, yeah, and there should be time, and there should be a bacteria, and there should also be, specifically these three.
Yes.
So when we actually, and there should also be food, food stuff, okay?
Yes, yes.
So when we like eat the food stuff and we actually keep them without brushing our teeth, what happens is we have bacteria in our mouth, which is actually normal flora. They are there, they are beneficial to our health. But then when we eat, like, let's say, sugary stuff, and they consume, they actually produce some acid. And it is these acids that actually start to actually rotten our teeth. Yeah. So after some time, that's when you actually find out that there is a cavity, and it goes deep and deep and deep, just because we are giving it a time. So what should we do to actually avoid this? We need to actually cut the action time of the acid by brushing. Okay? Because when we are brushing, we are neutralizing the acids, so it means it will not have time to actually decay our what? Our tooth. So specifically, what we need to do is we need to make sure we brush our teeth. That's the reason why we say we should actually brush at least 3 times a day. That is morning, afternoon, and evening. But we recommend 2 times, and these 2 times are when we are going to bed, and in the morning when we have just had breakfast. These are the 2 specific times that we need to brush daily. Okay? Yeah. The reason why I'm saying we should actually be brushing when we are going to bed is because that's the time when we have just had our supper. So that's the time that we have just had our supper. So we actually need to make sure we go to bed when our mouth is what? Is clean. Because if we happen to leave the foodstuffs in our mouth and bacteria is there, they will take advantage of those food debris. They will make use of that and they will produce acid. So since we are actually dormant, so the bacterial activity will actually prolong. You see? So to cut this out, we need to actually brush our teeth so that we go to bed when our mouths are what? Clean, and the bacteria will not have access to those foodstuffs. Meaning to say, they will not actually produce the acids that will make our teeth decay. Yeah.
So can you tell us how many times should a person go for dental checkups, and why are dental checkups important?
Dental checkups are important because that's the time when we actually spot the problem, and we can easily do what? We can easily control the problem. Yeah. Before it becomes worse. So it's very, very important for one to actually have a checkup be it once a year, but we recommend two times a year, which is every 6 months. Every 6 months, one is supposed to actually come for a checkup. It's very, very good. Yeah.
So, what are the options when one wants to replace your teeth? What?
Yeah. In fact, there is this treatment we call dentures. You can actually go for a denture, yeah, or you can go for dental implants. These are all artificial teeth that are placed to replace the lost what? The lost teeth. So you can go for either dentures, bridges, or you can go for dental implants. Yeah.
So I have seen some people they have braces. So I want to know what is the meaning of braces for teeth protection and what and when does a doctor prescribe that this person needs braces?
Yeah, okay. Bracelets are actually put in place to actually straighten the teeth.
Yes.
To straighten the teeth. And this is specifically done by the orthodontists. Yeah, that's the actually field called orthodontic. That's orthodontic treatment. They straighten the teeth. Yeah. So one can go for orthodontics when he or she has a like when he has
Like a root teeth?
not lost teeth, but when he cannot actually have a good bite, yeah. So he can go for orthodontic treatment. Yeah.
So can you tell us the benefits of using toothpaste in the mouthwash?
As for toothpaste, it's more of neutralizing the acids that are responsible for what? Tooth decay.
Yes.
And as for what? And mouthwash.
Yes.
The mouthwash, some other mouthwash contains some antibiotics.
Yes.
So mouthwash do eliminate the bacteria that's responsible for like tooth decay and the gum diseases. Yeah.
So can you tell us the different types of procedures for correcting misaligned teeth?
Yeah, I think that's what we have just talked about. Yeah, the orthodontic treatment.
Yes.
Yeah. So they do put in place these bracelets so that they correct the misalignment. Yeah.
So can you explain to us the difference between a root canal and the teeth extraction?
Tooth canal.
Root canal.
Okay, root canal. Okay. We do root canal when the tooth decay has actually reached the pulp, the pulp cavity. So at this point, we cannot actually do a normal filling. A normal filling, just because the infection has gone into the pulp. Okay. So what we do is we actually do root canal, which is the removal of the what? The pulp. We remove the pulp and render the tooth dead, and we replace it with we restore it Yeah. So you can actually use the tooth, but then it's actually what? Dead. Because you have removed the pulp.
Yeah.
You have removed the pulp.
Yeah.
So the tooth is dead, but you have just restored it. So a person can still more be using the tooth for like chewing and anything else. As for tooth extraction, is another treatment we actually render where we cannot manage to do root canal. So we just remove the tooth. So this procedure is called extraction. Or tooth removal.
So can you explain to us and this the common causes of tooth pain and how can these common causes be managed, or how can tooth pain be managed?
Okay. The main cause of
tooth pain.
Tooth pain is actually dental decay, or dental caries, or tooth decay. Is the common cause of dental pain. And also the gum disease, also known as gingivitis, is also the other cause of tooth pain. Okay. So the best we can do is to actually prevent. How can we prevent? We can prevent by making sure we brush at least two times a day. Yeah. In this way, we can actually avoid tooth decay or gum disease. But where we have tooth decay, then you can always come for a tooth filling, or root canal, or tooth extraction. These are the main three option treatments for like tooth pain or gum disease. Or you can, for the gum disease, you can go for scaling, which is professional cleaning of the teeth. Yeah.
So
that's that.
what are the risk factors caused by like poor oral hygiene? What happens when a patient has poor oral hygiene? What are
The risk factors?
Yeah, risk factors.
I think the risk factors are mainly the sugary stuff. Sugary stuff, especially the processed sugars, like the one we use in tea, the one they use when they are processing, like maybe biscuits and some candy foods. These are actually the main factors, like the sugars, the bacteria, which is just the normal flora, and also the time frame where we actually when we eat and we don't blush. If we actually take a lot of time, it means we are exposing our teeth to like these acids which are produced by these bacteria. So basically the main factor is the sugar. So by eliminating the sugars through blushing, I think we can actually control tooth decay and the gum diseases.
So can you explain to us the main connection between oral health and the patient's overall health? How important is it for a patient to keep oral health so that the entire body is fine?
I think we cannot talk of general health minus oral health, because these two go hand in hand. For instance, when like somebody is suffering from, let's say, Kaposi sarcoma, which is like the cancer of the skin. This presents itself first in the mouth. you can see some purplish patches on the tongue or on the palate. So this appears first in the mouth, before it even appears in the whole body. So there are so many diseases that express themselves in the mouth first before they actually show out in the whole body. Yeah, so that's the reason why I was quick to say we cannot talk oral health, we cannot talk general health minus oral health, because these are like they go hand in hand. Yeah. So by taking care of our oral health, we also take care of the general health, because some conditions like the gum diseases, the tooth decay, at times they can also affect some other areas of the body, like the heart, the brain, and the whole body in general. So by taking care of the oral health, it means you are also taking care of the general health. Yeah.
So as you can see, today we have learned a lot about how to protect our teeth, why it is important to protect our teeth and everything, and how oral health connects to the health of the entire body. As always, you have been with me, Dr. Kam'mwamba, and I was joined by
Prince Chimenya, your own dental therapist from Choro District Hospital.
So until next time, this has been Let's Talk Health.